Eating. It's something most of us enjoy and something we all have to do. But have you ever thought about how tough eating would be without your teeth? If you ever lose your natural teeth, you'll be losing 75% of your ability to eat, no matter how good your dentures are. There's really no substitute for your natural teeth for eating or for flashing that big smile. And there's really no good reason for losing your teeth either, because teeth are not lost as an inevitable part of growing old. Most are lost due to simple carelessness and poor dental hygiene. Brushing is important, but it's not enough. There are 3 additional things you must do besides brushing to prevent gum disease and tooth decay. First, let's look at what our teeth are up against. Your mouth is full of millions of microscopic organisms and bacteria. All these tiny creatures live on the same food you do. They eat what you eat and then give off waste products that cause tooth decay and gum disease. You know this tooth-harming enemy as plaque. A furry covering on your teeth or bad breath are signs that plaque is building up. Plaque loves sugar, but it can also live on the fluids in your mouth, breaking them down and causing the worst problem of all, gum disease. Gum disease is the leading cause of tooth loss. So now that you know the enemy, these tiny organisms that live in everyone's mouth all the time, what can you do? How can tooth decay and gum disease be prevented? The answer is simple: flossing and brushing correctly. When done properly, flossing and brushing remove and disorganize the organisms that cause tooth decay and gum disease. After flossing and brushing, it takes about 24 hours for the organisms to reorganize. This means that a properly done, do-it-yourself cleaning program really works. Clean teeth and gums are highly resistant to disease. So here's the good news. Your teeth are meant to last a lifetime. And they can, with regular dental checkups and proper daily oral hygiene at home. Carrying out a good program of oral hygiene is simpler than you might expect. Just follow these 4 steps. First, inspection. It helps to know exactly where your teeth need cleaning. You can use a disclosing product which marks the bacteria and their products known as plaque. You'll find them concentrated in 3 areas: along the gum lines, between teeth, and on the chewing surfaces. These are the places that must be kept clean to prevent decay and gum disease. It's a good idea to use the disclosing product before you brush each day for a week to show areas where plaque has accumulated. The next week, clean your teeth first and then stain them to see if you're missing any areas. After you establish a pattern of good oral hygiene, you can use the stain occasionally to check yourself. Step 2. Flossing. This is the most important step of all. If you won't take the time to both brush and floss, then throw away your toothbrush and just floss every day. Most decay and gum disease takes place between the teeth, where your toothbrush cannot reach. Flossing is the only way to clean these crucial areas. Once you make flossing a habit, you'll find it's easy and only takes a short time each day. Use a piece of thin, unwaxed dental floss about 2 feet long. Just grip it naturally, anchoring one end by wrapping it around your right index finger. Use your thumb to hold the floss against your finger and grasp it with your left hand so that you have about 1 inch of floss to work with at a time. Slip the floss between your teeth by drawing it gently back and forth. Carry the floss under your gum line until you feel definite resistance without discomfort, and scrape it upward and downward along the sides of both teeth. Repeat this procedure for each tooth. Step 3. Brushing. If you've been using a hard toothbrush, you've probably been overbrushing and undercleaning your teeth and gums, even eroding your teeth and pushing your gums away from your teeth. The proper toothbrush bristles are small in diameter and feel soft. These soft bristles are gentle enough to be worked in between the teeth and around the gums without harming the soft tissue or pushing it away from the roots. Brush with short strokes, directed upward on the upper teeth and downward on the lower teeth, moving the brush back and forth with a circular motion, applying firm but light pressure. This digging type of action will dislodge the soft stained material containing the bacteria. Too much bending or flaring of the bristles indicates that too much pressure is being used. On the bottom teeth, it's important to brush downward at an angle of approximately 45 degrees. This will enable the bacteria to be dislodged from between your gums and teeth and from between the teeth themselves. Brushing behind your lower front teeth can be difficult. To make it easier, raise the handle of the toothbrush so you can clean down in between the gums and teeth, pushing downward with a circular motion. On the upper teeth, do exactly the opposite, brushing upward instead of downward. And to reach the area behind your upper front teeth, angle the handle of the toothbrush downward so the bristles can once again get in between the teeth and gums. Remember, you are still brushing upward with a slight circular motion. What about toothpaste? Well, it's helpful but not essential, contrary to what most people think. Most toothpaste brands contain abrasives that can actually wear grooves in the teeth if used in excess. And some are irritating to the gums. The best plan is to brush with water or non-irritating mouthwash. Then brush a second time with a small amount of toothpaste to polish the teeth slightly and leave a pleasant taste in your mouth. Step 4. Rinsing. This step is almost self-explanatory. Just force water vigorously back and forth between your teeth after brushing and flossing to remove the loosened material. Not only does rinsing wash away debris, the water helps dilute the fluids in gum pockets that, when acted upon by bacteria and their products, irritate and destroy gum tissue. After rinsing, re-inspect your teeth. If all the red stain is gone, so are the bacteria and their products. The most important time to thoroughly clean your teeth is every night before you go to sleep and when you get up in the morning before eating breakfast. Most decay takes place 5 to 19 minutes after eating. It's better to clean your teeth before eating than after, because if these organisms and their products are disorganized, they cannot break down the refined sugar that causes decay. The bacteria will reorganize every 24 hours, so daily and nightly cleanings are a must. Additional cleanings will also give your mouth a nice, refreshing feeling and remove the food particles which accumulate during the day. Now that we've shown you the 4 basic steps for good oral hygiene and a healthy smile: inspection, flossing, brushing, and rinsing, the rest is up to you. You can make your teeth last a lifetime with little or no dental repair needed. But like anything else worth having, it requires some time and effort. The results? Healthy, attractive teeth with a minimum number of dental treatments will be well worth it. You've seen what good oral hygiene can do. So let's look for a minute at how improper care can ruin your smile. How would you like to lose more than 75% efficiency in your ability to eat? It happens to many people who lose their natural teeth through improper care. Because even the finest dentist and the best dentures made can't begin to duplicate the power of your natural teeth. With full upper and lower dentures, a maximum pressure of 37 pounds per square inch is exerted when you chew. And the dentures are often dislodged when chewing. No matter how well they fit, dislodging occurs because the dentures rest on soft gum tissue instead of being anchored in the bone like natural teeth. Now, compare the 37 pounds of pressure you can get with dentures to the chewing pressure of 150 to 250 pounds per square inch that you can easily and normally accomplish with natural teeth. Just think about those big, juicy steaks, corn crisp apples, and barbecue ribs to eat. You get the picture. But what if you already have a mouth full of fillings? It's still not too late to benefit from proper oral hygiene, starting today. Why have a good filling placed in a cavity and then allow decay to form around it due to improper care of your teeth? Let's review once more the material we've covered and the advantages of proper care at home. Clean teeth cannot get decay or cause gum trouble. The unpleasant breath caused by poor oral hygiene is eliminated, and economically speaking, good care at home saves you money, since professional dental care is kept to a minimum. Your teeth are a precious asset in terms of both beauty and function. They affect your appearance, your health, and your comfort. Take the time to preserve them, and you'll be smiling for a lifetime.